welcome back to my channel. I'm excited to come on and talk to you guys today about some specifics of my diagnosis and my actual mastectomy reconstruction surgery. It was the more requested video, and so here we are. I am sitting in front of you today 4 weeks out from my surgery, and I had a full removal of both sides of my breast, and I was lucky enough to do the implant surgery at the same time. So I've had a wonderful experience with my doctors, and I'm happy to take you through some of the things that I did that made it so easy for me. And if anyone out there is watching, getting ready to embark on this, there's hope. It is totally not that bad, and you're gonna be just fine. So there's nothing to worry about. Your body can handle this. It's just about you getting your mind right. So when I first got diagnosed, the very first thing, this is Sumo, my dog, he's with us today. The very first thing that happened is I actually met with a surgeon. And the reason for that is my biopsy and my imaging showed that they believed I had a tumor that was controlled in one spot. It looked to be small enough, and it looked like there was no lymph node activity. And so I didn't have to go into further like body scans, and my blood work looked really good as well. And so my cancer surgeon was the first doctor that I actually met and saw when it came to specialist for my treatment plan. And when I met her, she explained to me I had a couple of options. I could just take out the tumor, I could just take out my bad breast, which is my left side, or I could take out both. And due to my own personal decisions, and this is something that's really unique to each woman as an individual, I had no hesitation, and I knew right from the start that I wanted to just take everything out. And at that point, she told me I was a candidate to actually have an implant surgery right away, which is a little bit more rare. Typically what they're going to do is put expanders in, and over the months you'll get injections of saline to then stretch the skin back out and be able to go put the implants in after. But the reason I was a good candidate for this is, number one, my situation of my actual pathology seemed to be controlled. Number two, I wasn't looking to go bigger in size. And number three, for me, psychologically, it just was a lot easier for me to think about and digest doing one surgery and being finished versus having to go through multiple surgeries and maybe visually seeing something that was a little bit more tough to digest. But I was lucky enough to have a starting point where it was feasible to keep me whole and to keep me at a good size. So I opted to take everything out and do one surgery. So I did that, and prior to the surgery, I had a ultrasound, I had an MRI, and I had a biopsy. And all three of those tests were showing congruent kind of reports of what they thought was going on. So what they thought was going on was specifically a triple negative breast cancer. Triple negative means that none of the hormone traces are found in my type of cancer. It is the most rare type of breast cancer, and it's also the highest grade, meaning the most aggressive, because it's not hormone based. With that being said, the treatment plan for that is a little bit more generalized versus if you have any of the three hormone profiles, it's a very, very targeted treatment plan. But because mine includes no hormones, was another reason why I decided to take everything out. So when you get diagnosed with breast cancer, everybody was asking me, what stage are you? What stage are you? They kind of classify things in stages and in grades. So a stage would be how big is the tumor, how much has it spread, what are the markers. So markers means the tumor's in a certain spot, but where are the cells kind of growing out of? Do you have any activity in your lymph nodes? That would be the first stop of it moving. And then if it is in your lymph nodes, is it anywhere else in your body? So the staging is based on that kind of pathology. So it looked prior to my surgery that I was about a stage 1, that I had this one small, less than 2 centimeter tumor. They didn't think that I had further activity in my lymph nodes or anywhere else in my body. The second way they diagnose is by the grade. So I explained to you I am a grade 3. All triple negatives are grade 3, which is the highest grade. There is also grade 1 and grade 2 depending on what your hormone profiles are if you don't have triple negative. So we knew right away that I was a grade 3 because of the triple negative, and we were thinking I was a stage 1. But the hard thing and the kind of frustrating thing about this whole journey, and where you can get really mentally fucked up over this, you get a mammogram and it says suspicious. You get a biopsy and it says, okay, this is what we see. But until the surgeon actually goes in there and they extract all the tissue and they extract the lymph nodes, you really don't have a defined pathology of actually how far or how bad or how good it is. And so for me, it was about 2 months from the initial phone call until my final pathology report of the surgery, because that's really where you're gonna get the information, is actually from the surgery. And so my surgery came out, and sure enough, it was exactly what the imaging said. I've heard so many horror stories about images being drastically different. And if you're watching out there, I am somebody that is telling you what my imaging said is exactly what they found. So don't get your head all wrapped up around, what if it's worse? What if it's worse? Like, just chill. So my exact tumor was literally to the centimeter of what they thought it was. My markers were really good, meaning I had a lot of surface area that wasn't affected in my actual tissue, and I had no activity in my lymph nodes. My doctor ended up taking 3 sentinel nodes, and what she thought was 1 additional lymph node, but that one actually ended up being 2. So I had a total of 5 removed. So if they take out 1 or 2 or 5, it doesn't necessarily mean that's a bad thing. So it just means that their pathology was taking them down that route. And it also means the ones that they took out scientifically are the ones in the future that would be kind of the first stop if something were to reoccur. So for safety purposes, they take things out. So again, if they take out a bunch, it doesn't necessarily mean it's bad. It's just they're making sure that their bases are covered for everything. And so then that was my final pathology report. There is a bit of a question for me personally. In the mammogram and in the biopsy, they were showing these kind of what they call satellite locations that look to be these small tumors, but they were really tiny, like 6 centimeters by 6 centimeters and 4 by 4. The doctor doing my biopsy couldn't even get to the 4 by 4 because he couldn't see it. And then the 6 by 6, he extracted tissue, but it was kind of a gamble and a crapshoot whether he was actually getting that what seemed to be tumor or if he was getting tissue. But when he did the biopsy, it completely removed it off of the ultrasound. So in my pathology reports, there was no sign of any additional tumors. And so they're sending my pathology back for 1 more run. So if you have like a little bit of a weird case, make sure you advocate for yourself to get it retested if you need to get it retested. And they're gonna look and slice up a little bit more of that tissue into these tiny little scans to see about those additional ones. And in my biopsy, it was showing some estrogen on a very, very, very weak level. And so if it comes back that those were legit or that they find some trace, we'll deal with it at that point if it's something that has to do with estrogen. But for right now, we're treating the main quote unquote big one, which isn't even that big, as a triple negative to make sure that we take care of that, which is the main concern. So that will require chemotherapy. My doctor has chosen a drug cocktail called TC. It will be 4 rounds spread 3 weeks apart. So that'll be my next journey starting here in about a week or 2 that I'll be taking on, and I'll definitely be videoing through that because I'm gonna do all the crazy shit in the world, from naturopath to food to fasting to cold capping to try to keep some of my hair, all of my hair, half of my hair. We'll see what happens. And I'm going to take it on with every resource that I can. I've done a lot of research, and at the end of the day, it's going to be left up to the universe and to God to take that path as it should. But I'm definitely advocating for myself and feeling very much in control of what I can do to take care of myself pre going into that, and also throughout that journey, and we'll just go with the flow. So if I get to keep some of my hair, great. If I get to keep all of it, awesome. If I end up having to shave it, all right, that's what was meant to be. But we're gonna take that on and go step by step through that journey as well. So I've had about a month and call it 6 weeks to prep after my surgery into that next step. And post-surgery has been super smooth. The worst of it was just the side effects from the pain medicine, which you need the pain medicine because this shit's a big deal. Like, you're not gonna get through it without being on pain medicine. But between digestive issues and blood pressure things, those were pretty much the kind of annoying nuances from the surgery. But I had no complications and everything is healing awesome. I'm already working out about 30 minutes on the bike every day and doing my physical therapy stretches. I mean, I'm not going to like an exercise class or pounding a bunch of weights over my head, but I'm feeling awesome, and you can too. So I still stand very firm that a big part of this whole journey is your mental mindset. And so whether you're sick or you're not sick, like, fuck that. Don't wait till you're sick to figure this out. Wake up every day and count your blessings and write them down in a journal so you can be clear. And no matter how shitty your day was, there was always something good in it. So never underestimate that. I start every single day with a guided meditation, and then I take 5 minutes and write down in my journal all the things that I'm in control of and the things that I'm thankful for and the things that are going to go great for me. And they do. Like, you are in charge of creating your own destiny. So sometimes shit happens to us that we can't control and we don't know why. But we don't need to know why. And we don't need to control it, because there's something way larger than you out there that's putting things in front of you in your life, and it's for a reason. Maybe we don't know it right now. Maybe it's frustrating right now. Maybe it's annoying right now. Maybe it's hard right now. But it's for a reason. And we need to embrace that and also understand that we're not always in control of the outcome. I'm not in control of what my pathology report's gonna say. I wasn't in control of how my surgery was gonna go. I wasn't in control of a lot of this. I mean, I guess I got to choose to do the type of surgery I did, but I didn't get to choose that I have this fucking thing. I didn't get to choose that I had to do this, but you know what? If we relinquish and surrender to the greater universe around stopping trying to control every single step of the way and just embracing it, the journey becomes not only way easier, but actually incredibly gratifying, even if it started off as a really fucking bad thing. There's always good and stuff. And so wake up every day and write that shit down and be appreciative for it. And don't bitch about the shit that's bad. Be grateful and happy about the stuff that's good. And always know your life wasn't meant to be lived in struggle. Your life was meant to be lived in joy. And so choose the joy. Let go of the struggle, and no matter what, there's always somebody out there that has it worse than you, so shut the fuck up with your complaining and be happy with what you have. So if I can go through this kind of stuff and still be smiling every day and still be happy and still, like, I'm literally getting excited to go get chemo because it's one step closer to being done and I know I'm in good hands. So be excited about the good stuff happening and know it's all about your perspective. So catch me soon. I'll keep recording these videos for you guys, and I really appreciate you watching and following. Thank you and have a great day. Bye.